झालं ह्याचं झालं.
नमस्कार सभी को। आज के इस इंटरनेशनल वुमेन्स डे वर्चुअल सेलिब्रेशन में आप सभी का बहुत बहुत स्वागत है। आज हमारे साथ अलग अलग क्षेत्र में कार्य करने वाले जो एक प्रतिभा संपन्न महिला व्यक्तिमत्व है, उन सभी का मैं यहाँ पर बहुत बहुत स्वागत करती हूँ। और कार्यक्रम का आरंभ हम लोग धन्वंतरी प्रार्थना से करते हैं, तो आप सभी का स्वागत करते हुए हम सबसे पहले धन्वंतरी प्रार्थना को यहाँ पे प्रस्तुत करते हैं और फिर हम आगे कार्यक्रम को चलाते हैं।
शंखं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनं मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्।
नमस्ते मैम। विजिट ऑल इनोवेशंस एंड टेक्नोलॉजी फॉर जेंडर इक्वालिटी, इस थीम के साथ हम लोग इस साल का ये इंटरनेशनल वुमेन्स डे सेलिब्रेट कर रहे हैं। और इसमें आज का हमारा जो सत्र है हमारे अलग अलग क्षेत्र में कार्य करने वाले महिलाओं को समर्पित है। आज सबसे पहले द सीनियर मोस्ट डॉक्टर अनुरा बाले यहाँ पे हमारे साथ उपस्थित है, जो कि प्रिंसिपल है शिरोडा कॉलेज गोवा से। बट जैसे कि मैडम की पढ़ाई तो महाराष्ट्र में हो चुकी है। मैडम इज MD एंड PhD इन क्रिया शारीर। अलग अलग अवार्ड्स उन्होंने हासिल प्राप्त किए हैं, लाइक बेस्ट टीचर अवार्ड बाय AISSR। प्रकृति असेसमेंट का उनका खुद का एक अनुभव है एंड पंचभौतिक मॉडल भी उन्होंने बनाया है अंडर AISRI। अलग अलग बोर्ड्स पर मैडम काम कर चुकी है। शी इज member of Executive Council Goa University, member of Academic Council Goa University, member of Advisory Council of Indian System of Medicines since January 2021, member of IHEC Committee Goa University, chairman Board of Studies in Yoga and Naturopathy Goa University। So अलग अलग अवार्ड्स भी उन्होंने प्राप्त किए हैं, जैसे कि आयुर्वेदाचार्य अवार्ड है, अवार्ड बाय गोवा आयुर्वेद मेडिकल एसोसिएशन एंड अलग अलग क्षेत्र में मैडम काम करती है। तो यहाँ पर मैडम का मैं स्वागत करती हूँ आयुष दर्पण परिवार की तरफ से। और उनका आज का विषय है एडमिनिस्ट्रेशन किस प्रकार से, लाइक मैडम बहुत सालों से इस फील्ड में है एंड प्रिंसिपल की पोस्ट काफी अच्छे से वो संभाल रही है। तो वो अपने अनुभव और हमारे लिए भी कुछ मार्गदर्शन के तौर पर यहाँ पे वक्तव्य अपना देंगी। तो मैडम स्वागत है आपका एंड आई हैंड ओवर टू यू मैम, प्लीज।
Madam, thank you very much. Yeah. So, respected team of Ayush Darpan, the organizers, here madam, and the respected guest speakers. So, very good evening to all of you. And I wish you all of all International Women's Day. As we are given the topic of administration. Administration is really a very difficult task, but very interesting one. So let us first say that regarding International Women's Day, this is the global day celebrated everywhere internationally, celebrating social, economic, cultural, and political achievements of the women. It's about to raise awareness about discrimination and take action to drive gender parity. The UN theme for this year's International Women's Day, as everybody knows, is Digit All, Innovation and Technology for Gender Equality. Here you can say that women may hold the key to building a world free from hunger or poverty, yet gender equality could be putting a brake on sustainable development worldwide. Around 80% living poverty life live in rural areas and rely on agriculture income. Women across the globe, I would say, play a key role in the agriculture sector. So the role of women is very important everywhere. Administration, let us see administration, when we say what is administration? Good administration means getting it right, customer focused, being open and accountable, and acting fairly and proportionately. This is a very important point. I have been into administration for last 15 years, being the principal of the institute and superintendent of the hospital. This administration, as I said, it's a mixture of organizational theory, social theory, you can say, or political, etc. It's the act of managing something, I would say, for example, would be like managing an organization or a business. It's a very important thing that you have to maintain a productive office work. Something should be constructive. When you are into administration, you should see that you should be visionary always. Have some vision. It should be constructive, and productivity is very important. Anywhere you go, even in the factory or pharmaceutical, you see what is the productivity. In the institution also, see what is seen is the productivity. You should produce good vaidyas. Then here, as far as our medical colleges are concerned, or anywhere you see, when you see administration, it is regarding problems of the faculty members, teaching faculty or non-teaching faculty you can take, or the most important part is students in the, and you say hospital, many things come into it. So when we first consider about the problems of the teaching in the administration, first of all, what you for a woman, you have to look into about your household work, which is very important. Family is the most important part. So you have to look after your family. You have to look after, you have to look after the students. So many things you have to bring into line, bring uniformity like in working. You cannot be biased, you cannot be imbalanced into it. If you are imbalanced, somewhere the administration gets disturbed. For example, when we say teaching problems, now the theme itself as it is digital. Here the technology part comes. Even if you see national education policy is coming out with academic bank credit. Here also it's all digital, it will be for the students, safety of the students. Wherever the student goes, everything will be seen on the portal, digital. So next, even regarding admissions students, when you consider admissions of the students, they are online now. There are attendance of the students. Even you have to take unit test of the student, the result is online. So everything has to be in proper play, in proper schedule, time you have to submit. If you are late, if you are little late, within 1 hour, 1 minute also, you cannot upload on the portal. So this has to be in time. That's very important. So whatever in the administration work you take, it has to be done in the stipulated period. For this, you have to form certain committees. And that's because you see administration, one principal cannot do all the work. It's all teamwork. because all the staff members are very important. Single principal will not do any work. It's a teamwork. Everybody is, the work has to be distributed, given to all the members. Then you can get the feedback, and then if you get the feedback properly, it can be streamlined also. When you say teachers, it is the attendance of the teachers also, scale salary part of the teachers also, leave register of the teachers also, and first and foremost important to is the quality and regularity. One has to be very punctual. In the administration, my experience goes is you have to be oneself have to be very punctual in time. You have to be in time to the institute. If you are not in time, you cannot tell others that you have to be in time in doing that work. So first of all, one has to maintain punctuality, regularity in the work. Then you can tell others. For example, simple, I tell you, in the timetable. When the students are admitted, timetable is very important part. It has to be given to on the notice, displayed on the notice board when they are admitted. Now the first batch is admitted. If you see 22, 23 batches admitted now, and what is going on is transitional curriculum, which is said by NCISM. So, sorry, when you do this transitional curriculum, well in advance, this schedule has to be done. It has to be informed to all the speakers, and it has to be regularized properly. Within those 15 days, it has to be completed. So one principal cannot do it. Administration is here. It has to, the work has to be distributed, as I said. So committee is formed. The coordinators are formed. It is given to the work of to the coordinators. They have to coordinate to each of the guest speaker, and these things are to be done. Then only the work can be done properly and smoothly. Also, the time of the guest speaker has to be, time schedule of the guest speaker has to be maintained. This is regarding all. And then you have to give them the timetable. And as per the timetable, you have to observe whether the lectures are conducted in time or not. So when you see the administration part, you cannot be biased. You have to be uniform to all. And you have to be good. First of all, you have to have patience. That's very important. And you have to be good to all. Then only the team, you can get response. You cannot command everybody. You have to get the work done without commanding nature. Then only the work is done by the staff. This is most important in the administration. And that's what I feel personally. Because for this last 15 years, I feel that our staff does work very potentially and very dedicatedly, because they are being trained in that way, and the work is done in, receive the work inputs from them in this way. Even the same thing if you see in the examination pattern, examinations to be conducted in time. University academic calendar has to be submitted in time. So there are many university matters are there, and say some council matters are there. Many regularly come to you. There are many activities, many webinars are there. You have to conduct many seminars, other activities of the students also regarding cultural activities are there. Sports activities are there. All have to be done proper. This is administration work is not very easy. It's really difficult, but if you do it in a proper way, it's very interesting and nice. And once the work is done properly, positively, the satisfaction you get is very different from other happiness. What you get is very good. So here, even if you see the hospital staff, even I'm the superintendent of the hospital staff, if you see, you have to put on their duty schedule regularly. Most important is the duty roster. This duty roster has to be maintained. Patient's record have to be maintained of the IPD, of the OPD, timetable of the OPD consultants, whether the patients are attended in time. In the IPD also, whether the patients are given medications in time, whether the patient is relieved from the symptoms, patient is satisfied with the medications what you give, or you may give some panchakarma, whatever procedures you give. All this has to be regularized. And this is very important and updated. And one most important thing is statistical data. All the statistics has to be regularly maintained. If you consider the NEP, if you consider the inspection format, if you see, statistical data is very important, has to be done in time properly. So many things in the administration you have to keep in mind. Instead, you have to maintain a diary, point-wise, day-to-day, what the work is done and what the work has to be done, has to be noted, and then only it can be worked out very peacefully and very nicely. So these are the certain things, as I said, being acting fairly and proportionately. You have to be open and accountable to all. Open in the sense, whenever you do something, whenever you want any activity to be done, it has to be informed to all, notified to all. All the activities you are informed the committees, and the work has to be notified to all, the maybe teaching staff, maybe non-teaching, maybe students. The work has to be notified and accountability has to be taken. What work is done? Suppose the camps you are doing, there are many Suvarna Prashan camps. Every monthly there is Suvarna Prashan camp you are doing. So the accountability has to be there. How many camps are done in this year? How many students are benefited? And how many students have attended, or how many children have attended this camp? Or if you do other medical camps, how many people are benefited, how many people have attended, and how many have turned to your hospital back? If you have done in the other villages, how many people have come for the follow-up? So all this accountability, simple camp I am telling you, simple example, all this accountability has to be there. And this all documentation is very necessary as far as NET is concerned. All documentation you should have. All the pictures one should have, because there are new things are coming. Vruksha Ayurved is there, Pashu Ayurved is there. Many things are coming. So you have to keep record of all these things, what activities you are doing, what beneficial things you are doing for the students. Because teachers are all the facilitators, students have to learn. So what type of new teaching innovative techniques you have adopted? What are the assessment techniques you have adopted? Something new or the old pattern is followed? Because now, as per the NCISM, new technique has been given. It is the competency-based medical education which is come now. So there is new teaching methods are there, new innovation methods are given, and there are assessment methods are different. For example, there is debate, there is group discussion, there is puzzles in there, then interrogation is there, then presentation is there from the students, and finally some inputs from the teachers after completing one topic. So all this to be taken into consideration when you are into administration. Then getting it right or customer focused. It has to be customer focused. Here it is student centric. The teaching should be student centric. Student should know how, or once the student doesn't understand, it's your responsibility to make them understand and make them know the topic well. As far as their future or the applicability part, what it is there, it has to be brought to their notice. So teaching part, as far as students are concerned, teaching part is very important here. Students learn also how you have to, how they should understand and how you should make them understand, so that finally why we are here to make our students good Vaidyas. As I said, productivity should be there. The student should be good Vaidya to produce good Vaidyas. So the administration, hospital part, as I told you, IPD, OPD, or the hospital and board of hospital. Then there is, because it's the hospital, there are certain norms given by NABH. You have to follow those NABH norms. Cleanliness should be maintained. Everything, hygiene should be maintained. All the norms you have to follow for NABH. Again, the inspection comes. So all the affiliations from the university, there is inspection by the NEC, there is inspection by the NABH. So all these things will come in the picture when you are into administration, and you have to see to it that it's the most responsible post. When you are into administration, most responsible post, and you have to do it very with responsibility, and then only you can get good products. Your institute can develop good, because finally when we are into administration, we have to see that institute should develop, should progress. Your department should be good. There should be good development in the department, interdepartmental discussions, interdepartment research work. Research work is the most important part here. Now, even we have to tell students to do, we have to take one teacher and the students and tell them to do a research. Patients you can do, or as far as you can say physiology part is concerned, you can do with the prakriti of a person. There the research can be done. So research is one more activity you have to take most important part, because it is now scientific based, evidence based. What people want to know is science based, evidence based Ayurveda. People, if you say this Ayurveda says, people are not able to believe. They want it, all documentation is required. So you have to maintain the documentation here when you are doing any research. And one principal cannot do all these things. Hence I said there should be teamwork. You have to give work to each and every teacher and each and every student also, and then only you can get good productivity. This is all about the administration. When you say administration and public, it is the public administration is the study. It's a little bit different topic rather than administration, and use of the government policy, including both government as well as non-government management. Here, in the public administration, when you say, the principles are a little bit different. They include transparency and accountability, participation and pluralism, subsidiarity, efficiency and effectiveness, equity and access to services, multifaceted role of the public administration. Most important part in this is public-private partnership, social equity, and supervise the organization. This is regarding public administration. So here, what I would like to say, in this administration part, you are responsible for everything, provided you be visionary, be positive. Naturally, you are, but wherever you are into administration, maybe organization, maybe institute, it will develop. So this is all about the administration, what I wanted to say today. When we are saying about the International Women's Day, now there are many, on the top level, all the women posts have been occupied by the women. And women, there are evidences which show that women are given the right opportunity, ills on their farms or any other post to naturally. They show the incomes, natural resources are both better managed. Also, nutrition is improved in the kids and livelihoods are more secure. So if everything is taken by the woman, naturally, income is increased, well-nourished ideal children you see, and there is improvement in the livelihood also. So there should not be any biased things. Equality should be maintained in this. This is all I wanted to say, madam. Thank you for giving me the opportunity to explain my views. Even now, if you see, Honorable Modi has said, Beti Bachao, Beti Padhao. It's a very important scheme is come, wherein everybody learning, education is important for each and every child, and that has to be done. So thank you, ma'am, for giving me the opportunity to share my views. Thank you.
Nice, ma'am. Very impressive. And I think you have delivered all the duties, and it is really a vast area. बहुत ही like vast area है और आप काफी सालों से काम कर रहे हैं. So it's really like हम सभी के लिए आप एक inspiration के रूप में हो, ma'am. And thank you very much for sharing your experiences. And moving with our next speaker, I welcome Dr. Sudha Sharma ji. And she is from Haryana se hai, madam. And she has completed her graduation from MSM Ayurvedic College, Sonipat, Haryana, and running Ayurvedic and Panchakarma Center from last 17 years awarded by the Atre Award by Vishwa Ayurved Parishad. And madam has done very much like various type of courses like Ayurvedic cosmetology, Prasuti, Stri Rog Tantra, Panchakarma, Marma, Garbha Sanskar, and madam's specialization is in the field of Nadi Pariksha. So it's really interesting to learn and to listen with Sudha ji. I think Sudha ji हमारे साथ पहले भी जुड़ चुकी है, and it's really a very I think it's really nice area. Like Sri Vaidya, madam is working as a Sri Nadi Vaidya, so it's really interesting to learn from madam. And I know that the time limit is very short, but within this time you will cover some important points of as a Nadi Vaidya, Sri Nadi Vaidya. So welcome, ma'am.
Good evening, ma'am.
Yes, please.
Ma'am, am I audible?
Yes, continue. Yes, ma'am, you are clearly audible.
Yes.
Sudha ji.
Ma'am, I will share my PPT.
Yes, yeah. You can share, ma'am, yes.
Share
मैम वहां पे है, हाँ, यस, इसको मैक्सिमाइज करिए.
Ma'am, PPT
Yes,
to all and happy women.
Yes.
International
Yes, now clear, ma'am. You can continue. Yes, clear.
Women's Day. Happy हो मैम, जैसे कि आज अंतर्राष्ट्रीय महिला दिवस है और आपने है या मैं स्टार्टिंग से ही स्टार्ट करूं? शिल्पा मैम?
यस मैम, कंटिन्यू करिए, आवाज आ रही है आपकी. यस,
ठीक है. सबसे पहले
आई थिंक शेयर, आपने शेयर ऑप्शन स्टॉप कर दिया. स्क्रीन शेयरिंग स्टॉप हो गया. एक बार फिर से करिए मैम.
आगे चल रहा है. अच्छा इधर नहीं, ये आगे जा रही है। हाँ यहाँ से इसको
मैम आपकी
स्क्रॉल ऊपर
पीपीटी
करना।
क्लियर दिख रही थी।
ऊपर ऊपर। हाँ स्टार्टिंग में जाना है। नहीं और ऊपर जाना है। हम नेक्स्ट कैसे जाएं?
बस उसको मैक्सिमाइज करिए।
मैं मैक्सिमाइज है।
ये नहीं, अभी नहीं है, अभी नहीं हुआ है, मैक्सिमाइज नहीं हुआ।
बात है मैं
बट स्टार्ट करिए मैम। हाँ अभी दिखता है क्लियर। यस यस इट्स क्लियर।
तो मैम बहुत बार हम ये नहीं समझ पाते कि विदाउट टेक्नोलॉजी हाउ पॉसिबल। यही कुछ हम सभी का माइंड होता है कि हाउ इज इट पॉसिबल, बट इम्पॉसिबल इज कॉमन फॉर टुडे। अब हम स्टार्टिंग से करते हैं कि सबसे पहले हमें नाड़ी परीक्षा के लिए जो जो बेसिक चीजें हैं उनका पता होना बहुत जरूरी है। तो सबसे पहले अश्वत्थ परीक्षा, जो हमारे आयुर्वेद के पिलर्स हैं, कि हम जब भी कोई पेशेंट आयुर्वेदिक पर्सपेक्टिव से देखते हैं तो सबसे पहले वहां नाम आता है नाड़ी परीक्षा। देन यूरिन एग्जामिनेशन, मूत्र परीक्षा, मल परीक्षा, नेत्र परीक्षा, जीभा परीक्षा, और बाकी कैसे कोई पेशेंट हमसे बोल रहा है या उनकी जो वाक प्रवृत्ति है वो कैसी है, स्किन एग्जामिनेशन और प्रकृति परीक्षा। दीज आर 8 पिलर्स ऑफ आयुर्वेदा। नाड़ी जिसके पर्याय हैं स्नायु, तंतु, हंसी, धमनी, धारणी और विश्वा नाड़ी। इससे हम नाड़ी को अलग अलग उसमें बोल सकते हैं। अब हमें मेन है कि हमें नाड़ी परीक्षा की आवश्यकता क्या, क्यों महत्वपूर्ण है नाड़ी परीक्षा। तो जब भी हम किसी पेशेंट, जब कोई भी पेशेंट हमारे पास आता है, तो हम ये नहीं, हम आयुर्वेदा में ऐसे नहीं कर सकते कि हमें एक ही लाइन ऑफ ट्रीटमेंट से हम सभी पेशेंट्स को ट्रीट कर सके। तो वहां हमें सामने वाले पेशेंट की एक ही डिजीज के लिए अलग अलग प्रकृति और अलग अलग विकृति मिलती है, जिसके द्वारा हम उसको अंडरस्टैंड करके फिर हम जो है ट्रीटमेंट प्लान बनाते हैं। तो द एक्सपीरियंस आयुर्वेदिक फिजिशियन विल असेस प्रकृति, विकृति, दोषिक डिसऑर्डर्स, दूष्य पल्स ऑब्जर्वेशन, इवन प्रोग्नोसिस ऑफ डिजीज थ्रू नाड़ी परीक्षा। अब इसके लिए सबसे पहले हमें पंच महाभूत को जानना बहुत जरूरी है। वायु, वायु से हमारे कौन से सिस्टम रिलेटेड है ये भी पता होना चाहिए। तो सर्कुलेटरी और रेस्पिरेटरी सिस्टम, अग्नि डाइजेस्टिव सिस्टम, जल यूरिनोजेनिटल सिस्टम लोअर एब्डोमेन, पृथ्वी बिल्डिंग ब्लॉक्स ऑफ बोन्स, टीथ, सेल्स एंड टिश्यूज, आकाश नर्वस सिस्टम। दोषों की लोकेशन भी हमें नाड़ी परीक्षा आने से पहले जरूरी है कि हमें इस सब का ज्ञान हो। तो कौन सा दोष, उसकी लोकेशन कहाँ है। जैसे वायु की लोकेशन जो है बोन्स में है, बोन मैरो में है, ब्रेन में है, लार्ज इंटेस्टाइन है, लंग्स है, हार्ट है, यूरिनरी ब्लैडर है। और उसके फंक्शंस जो है वो है फिजिकल फंक्शंस में आता है रेस्पिरेटरी सिस्टम, सर्कुलेटरी सिस्टम, एक्सक्रीटरी, एब्जॉर्प्शन एंड एब्जॉर्प्शन। तो जब भी हम नाड़ी परीक्षा करते हैं और हमें जहां भी स्पंदन मिलता है, तो हमें उसके लिए, हमें अगर हम वात की कोई भी डिजीज फाइंड आउट करते हैं या हमें वात के स्थान पे कहीं भी स्पंदन महसूस होता है, तो हमें उसके स्थान पता होने चाहिए कि कौन से स्थान पे स्पंदन है और वहां से जुड़ी हुई कौन सी। पित्त दोष के वैसे ही कि पित्त दोष की लोकेशन है ब्लड, ब्रेन, आईज, एंडोक्राइन ग्लैंड, लिवर, टीथ, स्किन, स्मॉल इंटेस्टाइन एंड स्प्लीन। फंक्शंस उनके हैं डाइजेशन, एब्जॉर्प्शन, एसिमिलेशन, एपेटाइट, मेंटेनेंस ऑफ बॉडी टेम्परेचर। सेम कफ दोष, उसकी लोकेशन है ब्रेन, जॉइंट, लिम्ब, माउथ, पेरिकार्डियल कैविटी, प्लूरल कैविटी एंड स्टमक। उनके फंक्शंस हैं लुब्रिकेशन करना, रिपेयर, रीजनरेशन, टेस्ट परसेप्शन एंड किडनी रीअब्सॉर्प्शन। अब जब हम नाड़ी परीक्षा करते हैं तो वहां पहले दोष देखे जाते हैं कि वात है, पित्त है, कफ है। उसके बाद हम उनके सब टाइप्स देखते हैं कि हमें वो भी जरूरी है, क्योंकि जब हम सब टाइप्स ऑफ दोषा में कोई भी विकृति मिलती है तो वहां हमें पता होना चाहिए कि कौन सा दोष है और कौन से सिस्टम से रिलेटेड है। देन उदाहरण प्राणवायु, ब्रीदिंग एंड स्वेलोइंग, हार्ट, आर्टरी, वेन एंड नर्वस फंक्शन। उदान वायु स्पीच और मेमोरी से रिलेटेड है। समान वायु डाइजेशन से रिलेटेड है। व्यान वायु हमारे न्यूट्रिएंट से रिलेटेड है। अपान वायु हमारे फीसेस, यूरिन, मेंसेस एंड सीमन फॉर अ नॉर्मल पीरियड ऑफ टाइम एंड देन एक्सपेल आउट। सब टाइप्स ऑफ पित्ता, पाचक, रंजक, साधक, आलोचक एंड भ्राजक। पाचक पित्त की जरूरत है डाइजेशन में। जब भी पाचक पित्त अगर हमें विकृत मिलता है तो वहां डाइजेस्टिव सिस्टम से रिलेटेड डिसऑर्डर्स मिलते हैं। रंजक पित्त adds color to food juice that travel from stomach to liver। रंजक पित्त में अगर विकृति है तो लिवर से रिलेटेड प्रॉब्लम्स मिलती हैं। साधक पित्त, इसी तरह से आलोचक पित्त, भ्राजक पित्त। Then come to कफ सबटाइप्स, अवलंबक, क्लेदक, बोधक, तर्पक एंड श्लेषक। अवलंबक कफ हार्ट और थोरेक्स से रिलेटेड है। क्लेदक कफ जो है वो मॉइस्चन कर रहा है फूड को स्टमक के अंदर। बोधक कफ है हमें टेस्ट परसेप्शन दे रहा है। तर्पक कफ जो है हमारी सेंसेस को नरिश कर रहा है, हमारी ब्रेन फंक्शन। प्रेशर कफ जो है वो हमारे जॉइंट्स को मेंटेन कर रहा है। 7 टाइप्स की प्रकृति आयुर्वेद में वर्णित है। वात पित्ता कफा, वात पित्ता, वात कफा, पित्त कफा एंड त्रिदोष। तो इसी सबको जानने के लिए और इसी के लिए हमें नाड़ी परीक्षा की जरूरत पड़ती है कि हमारे सामने जो पेशेंट है वो वात पैथिक है, वात कफज है, पित्त वातिक है या कफ वातिक है, कफ पैथिक है या पित्त कफज है। टाइमिंग की बहुत बार ये इशू रहता है कि हमें कब जो है नाड़ी परीक्षा करनी चाहिए। तो आइडियली जो ग्रंथ कहता है, ग्रंथ में जो दिया हुआ है समय वो सुबह 6 बजे से 10 बजे तक का होता है, क्योंकि यह कफ काल माना गया है। परंतु आज के समय में हम इसको फॉलो नहीं कर पाते, क्योंकि हमारे पेशेंट दोपहर में भी आ रहा है, खाना खाने के बाद भी आ रहा है, शाम को भी आ रहा है। तो जिस भी कंडीशन में अगर पेशेंट होता है तो उस समय हम काल का निश्चय करके कि कौन सा काल चल रहा है, वात का काल चल रहा है, तो वात को थोड़ा सप्रेस करके हम बाकी की जो विकृति है उसको समझते हैं। क्या नहीं करना चाहिए, क्या करना चाहिए? तो नाड़ी वैद्य को मेडिटेशन सबसे पहले करनी चाहिए। मैंने आज तक जितने भी वेबिनार्स किए, जितने भी वर्कशॉप्स की, वहां सबसे ज्यादा कमी जो मुझे लगी कि मेडिटेशन कभी नहीं करते हैं। तो जब तक हम मेडिटेशन नहीं करेंगे तब तक हमें नाड़ी का ज्ञान अधूरा रहेगा। Both Vaidya and patient should wear loose clothes. During नाड़ी परीक्षण patient should sit relaxed, not cross legs। और सबसे बड़ी बात यह है कि पेशेंट का अपने वैद्य के ऊपर भरोसा होना, ट्रस्ट। अब हम जनरली नाड़ी परीक्षा जहाँ से शुरू होती है तो 3 प्रकार से हम देखते हैं कि वात की मूवमेंट्स हमें फील होती हैं, पित्त की मूवमेंट्स फील होती हैं और कफ की मूवमेंट्स फील होती है। जैसे पिक्चर में शो हो रहा है कि जो हमारी इंडेक्स फिंगर है वहां हम वात की फील करते हैं। जहां मिडिल फिंगर है, मिडिल फिंगर में हम पित्त मूवमेंट्स को फील करते हैं और रिंग फिंगर में हम कफ मूवमेंट्स को फील करते हैं। वात की मूवमेंट जो होगी वो हल्की शीतल, बहुत ही थ्रेडी हमें परसेप्शंस होती हैं उसकी, और फीबल स्पाइक होती है। पित्त की मूवमेंट्स जो होती हैं मेंढक की तरह होती है, जैसे वो जंपिंग गति होती है, थोड़ी हॉट होती हैं, स्ट्रॉन्ग होती हैं, एम्पलीट्यूड बहुत हाई होता है। कफ की मूवमेंट्स हंस गति होती है, स्लो होती है और वो हमें एक बड़ी सी वेव की तरह फील होती है। पल्स से भी हम बहुत बार प्रकृति परीक्षण कर सकते हैं। जैसे बात अगर बात करती है तो उसकी जो हार्ट बीट है वो 80 to 95 बीट्स पर मिनट मिलेगी। पित्त पल्स है जो उसकी 70 to 80 बीट्स पर मिनट होती है। कफ की जो है वो 50 to 60 बीट्स पर मिनट होती है। हेल्दी नाड़ी, यदि हमें कि हम कोई पेशेंट चेक कर रहे हैं और उसके अंदर जैसी हमें प्रकृति है वैसी ही विकृति मिलती है तो हम ये कह सकते हैं कि ये पेशेंट स्वस्थ है। 7 लेवल्स ऑफ पल्स, क्योंकि मेरा टॉपिक जो है वो दोष और दूष्य से है और मेरी जो आज का वो जो टॉपिक है वो स्त्री रोग है, तो उसके लिए मुझे जो है 5th लेवल पे जाना होगा जहाँ सब धातु जो है सातों धातुएं हैं वही आर्तव धातु में लेगी, तो हम सीधे वहां चलते हैं कि फर्स्ट लेवल जो हम देखते हैं तो वहां हमें विकृति और ऑर्गन पल्स मिलती है। सेकंड लेवल पे हमें सब टाइप्स ऑफ दोषा मिलते हैं जिसका वर्णन हम पीछे कर रहे थे, पंचवात, पंचपित्त, पंचकफ। उसके बाद हमें ओज, तेज और प्राण की स्पाइक्स मिलती हैं। फिर हमें सप्त धातु, यहीं से हम ओव्यूलेशन के बारे में जानते हैं, यहीं से हम मास अनुमासिक गर्भ के बारे में जानते हैं। छठे लेवल के ऊपर षट चक्र आते हैं। सेवेंथ लेवल पे हमें प्रकृति और डीप ऑर्गन की जो स्पंदन है। फिफ्थ लेवल नाड़ी परीक्षा हम इसे ऐसे कर सकते हैं कि जब हम प्रकृति देखते हैं तो प्रकृति से जस्ट हाफ पे आइए तो हमें वहां धातु पल्स मिल जाती है। फिफ्थ लेवल जो है वो रिप्रेजेंट करता है धातु को नाड़ी परीक्षा में। इंडेक्स फिंगर में मज्जा, आर्तव और अस्थि। मिडिल फिंगर में मेद, आर्तव और मांस धातु। रिंग फिंगर में रक्त धातु और रस धातु। तो आर्तव जो है वो हमें तीनों ही फिंगर्स में मिड पॉइंट के ऊपर हमें मिलता है। जैसे हम यहाँ शो कर रहे हैं कि जो हमारी इंडेक्स फिंगर है वहां हमें मज्जा और अस्थि, मिडिल फिंगर में मेद धातु और मांस धातु, और हमारी रिंग फिंगर के अंदर रस और रक्त धातु। बीच में हमें शुक्र और आर्तव का स्पंदन मिलता है। हम इसे फिंगर पे ऐसे शो करते हैं, तो जहां मैंने आर्तव और शुक्र लिखा हुआ है यहाँ से हमें फीमेल्स में आर्तव की स्पंदन मिलते हैं, और मेल पेशेंट है तो हमें यहाँ शुक्र से रिलेटेड प्रॉब्लम्स का स्पंदन मिलता है। अब हम कहते हैं इसको कैसे फील करें। तो हम जब सुपरफिशियल, सबसे पहले हम डीप जाते हैं किसी की भी, जैसे हम सभी नॉर्मली एक पेशेंट की पल्स देखते हैं, तो जहां पे हमें पहली पल्स बंद होने के बाद पहली पल्स हमें फील होती है तो उसको हम प्रकृति पल्स कहते हैं। उसको नोट डाउन कीजिए, वहां देखिए कि पेशेंट की प्रकृति वात है, पित्त है, कफ है, वात पित्त है या पित्त वात है या कफ वात है, कफ पित्त है। तो उसके बाद फिर हम जहां सबसे ऊपर हमें पेशेंट की सबसे पहला स्पंदन जहां मिलना शुरू होता है जब हम उसको पल्स को छोड़ देते हैं, जस्ट लाइक ऐसे जब हमने छोड़ा, तो जब हम डीप इसको करते हैं, तो जब हम बिल्कुल प्रेस करते हैं और जहां हमें पल्स बिल्कुल बंद हो जाती है उसे जस्ट थोड़ा सा हम ऊपर आते हैं, तो जहां से हमें स्पंदन मिलना शुरू हो जाता है तो हमें वहां प्रकृति पल्स होती है, और बिल्कुल जस्ट जो सुपरफिशियल है उसको हम जो है विकृति पल्स कहते हैं। आई विल शो इज देयर कि यहाँ ये थंब के हम यहाँ रेडियल जो है ट्यूबरसिटी है इसके जस्ट नीचे जाते हैं, और यहाँ पे हम 3 फिंगर्स रखते हैं जो हम जहां हमें सबसे पहले बिल्कुल ऐसे समझे कि फैदरी टच करने से जो स्पंदन मिले वो हमारी विकृति है। और जब हम उसको बिल्कुल डीप जाते हैं जहां स्पंदन बंद हो जाए और वहां से जस्ट हम तीनों फिंगर्स को एक साथ जब हम रिलीज करते हैं तो जो हमें पहला स्पंदन मिलता है वो विकृति है। तो हमें जो उस पल्स की जो मोटाई मिली, रेडियल पल्स की जो मोटाई है उसको हम स्टेप बाय स्टेप 7 लेवल्स में डिवाइड कर देते हैं, और जहां 5वां लेवल आता है वहां जो है हमें स्त्री रोग की पल्स मिलती है। हमें ऑन 5th लेवल अंडर वात पित्त का फिंगर्स मिड पॉइंट वी नो अबाउट शुक्र और आर्तव डिसऑर्डर। मैं अब थोड़ा सा पेशेंट से रिलेटेड जो हमें पल्स मिलती हैं उनके ऊपर डिस्कस करेंगे। कि सबसे पहले हमारे पास मोस्टली पेशेंट्स जो होते हैं इनफर्टिलिटी के होते हैं। व्हेन वी फील द स्पाइक अंडर फर्स्ट फिंगर एंड प्रेस लिटिल मोर इट फील्स ब्रेक एंड स्कैटर्ड, इट शोज इनफर्टिलिटी। कि जब मेन दोष जो हमें पेशेंट में मिलेगा, मेन दोष का मतलब विकृति, विकृति में जो हमें दोष मिलेगा वो होगा वात और वात कफ। और जहां हमें स्पाइक इंडेक्स फिंगर में, इंडेक्स फिंगर की मतलब जहां मज्जा धातु और अस्थि धातु जहां आती है वहां हमें आर्तव धातु में जो पल्स मिलती है उसे हम तब हम ये कहते हैं, और वो एक ऐसी पल्स होती है जहां हमें ऐसे लगता है कि जैसे हमारे हाथ से कोई कंच का गिलास टूट जाए या गिर जाए तो जैसे वो स्कैटर्ड हो जाता है, जस्ट लाइक इस तरह की जो पल्स मिलती है दैट इज कॉल्ड इनफर्टिलिटी पल्स। Uterine prolapse, most common disease in females when we feel वात spike under index finger। मेन दोष जो होगा वात कफ होगा। स्पाइक यहाँ भी हमें फर्स्ट फिंगर के अंदर ही मिलनी है, इंडेक्स फिंगर के अंदर ही मिलनी है, लेकिन इसके साथ हमें दूसरा दूष्य भी मिलेगा, क्योंकि जो हमारी रस धातु है और रस धातु जो पल्स है हमें आर्तव की, वो दो जगह से हमें डिस्टर्ब मिलेगी, विकृत मिलेगी। एक हमें रिंग फिंगर की जो आर्तव धातु पल्स है वो विकृत होगी, दूसरा हमारी इंडेक्स फिंगर की जो आर्तव धातु की पल्स है वो विकृत होगी, और दूसरा जो हमारी मांस धातु है, क्योंकि वहां पे क्या हुआ, वायु बढ़ गई है मांस धातु के अंदर, तो जो यूट्रस है वो जो है वो वहां से एक्सपेल डाउन होना शुरू हो जाता है, जिसके कारण गर्भाशय भ्रंश हो जाता है। तो यहाँ हमें मेन दोष जो विकृति में मिलेगा, वात कफ मिलेगा, स्पाइक जो है आर्तव इंडेक्स फिंगर में भी मिलेगा, रिंग फिंगर में भी मिलेगा, और मांस धातु में भी हमें स्पंदन मिलेगा। तो वी कैन सेट की दिस इज यूट्राइन प्रोलैप्स। endometriosis and endometritis, two diseases. When we feel वात spike under ring finger, यहाँ हमें मेन दोष वही वात का, लेकिन अगर एंडोमेट्राइटिस है दैट इज इंफ्लेमेटरी डिजीज, वहां हमारा मेन दोष चेंज होके वात कफ आ जाता है। स्पाइक जो है रिंग फिंगर में आएगी। अब रिंग फिंगर के अंदर, रिंग फिंगर मतलब कि हमारी कफ धातु की जो पल्स है, वहां कफज आर्तव लेवल पे हमें कफ की ही स्पाइक स्पंदन फील होगा। और अस्थि मज्जा में, इंडेक्स फिंगर में जहां अस्थि मज्जा हमने देखा था, वहां हमें वहां भी एक स्पंदन मिलेगा। और दूसरा जो हमने पंच दोषों की बात की, वहां अपान वायु में भी दुष्टि मिलेगी। देन वी कैन से दिस इज एंडोमेट्रियोसिस। एंडोमेट्राइटिस मेन दोष वात पित्त होगा, अपान वायु की दुष्टि यहाँ भी होगी, और पित्त वृद्धि मिलेगी हमें अपान वायु के अंदर। और इंडेक्स फिंगर के अंदर भी हमें जो है वहां पित्त की पल्स आएगी, वहां कफ की या वायु की पल्स नहीं होगी, बिकॉज वहां एक इन्फ्लामेशन है। लो एंडोमेट्रियम, मेनली केसेस ऑफ इनफर्टिलिटी कम्स विद लो एंडोमेट्रियम। मेन दोष वहां भी वात कफ मिलेगा, क्योंकि लो एंडोमेट्रियम है, थिनिंग है एंडोमेट्रियम की, तो वहां क्षय है। क्षय मीन वायु, कफ, क्योंकि उनको जब लो एंडोमेट्रियम होता है तो हमें एक मेन सिम्टम मिलता है कि पीरियड्स नहीं आते, मेंसेस उनके जो है स्किप कर जाते हैं। तो यहाँ भी हमें जो स्पाइक मिलती है वो रिंग फिंगर में मिलती है, और रस धातु के अंदर भी, क्योंकि वहां रस का भी क्षय हो रहा होता है, और रस और रस धातु की जो उप धातु है दैट इज आर्तव। तो यहाँ हमारा मेन दोष वात कफ है। वातर आर्तव लेवल रिंग फिंगर पे जो है हमारा कफज में, वहां रस धातु और आर्तव धातु दोनों के ऊपर ही हमें जब स्पाइक मिलती है, देन वी कैन से दिस इज लो एंडोमेट्रियम डिजीज। उदावर, या हम इसको आयुर्वेद में कहते हैं वातज आर्तव दुष्टि, कष्ट आर्तव या अल्प आर्तव। यहाँ जो मेन दोष है वो, वहां हमें वात की स्पाइक बहुत ज्यादा मिलती है, वहां पित्त की स्पाइक फीबल होंगी, वहां कफ की स्पाइक फीबल होगी, लेकिन मेन दोष वहां हमें वायु मिलता है। वात फिंगर जो हमारी इंडेक्स फिंगर है उसके नीचे ही हमें स्पाइक मिलती है, वायु की मिलेगी ना, कफ की मिलेगी ना, पित्त की मिलेगी, क्योंकि वहां पेन बहुत सीवियर होता है पेशेंट को, बहुत बार इंजेक्टेबल्स लेने के बाद भी रिलीफ नहीं आता। और यदि वहां हम अपान वायु के हिसाब से ट्रीटमेंट करते हैं तो हमारा पेशेंट वात शामक ट्रीटमेंट जब देते हैं तो उदावत के पेशेंट ठीक हो जाते हैं। यहाँ अपान वायु में भी वात की दुष्टि ही हमें आती है, वात की ही विकृति होती है, पित्त और कफ की विकृति नहीं आती। पित्तज आर्तव दुष्टि जिसे हम मेनोरेजिया कहते हैं, मेन दोष जो वहां है वहां वात पित्त और वात कफ। पित्तज आर्तव जो हमारी मिडिल फिंगर है, वहां हमें पित्त की बहुत ही सिवियर स्पाइक्स आती हैं, देन वी कैन से दिस इज पित्तज, दिस इज मेनोरेजिया, अत्यार्तव। उत्तराग्नि योनि व्यापक जिनमें रिकरेंट अबॉर्शंस की हिस्ट्री होती है, यहाँ जो मेन दोष होता है वो वात और पित्त आपको मिलेगा। जब हम विकृति में देख रहे हैं, ये सभी मेन दोष जो है ये हमें विकृति में मिलते हैं, प्रकृति में नहीं मिलते। प्रकृति ऑलवेज सेम टिल डेथ। स्पाइक जो हमें मिलेगी इंडेक्स फिंगर में मिलेगी, आर्तव धातु की पल के नीचे मिलेगी, और रक्त धातु के अंदर, क्योंकि वहां जो रक्त में पित्त बढ़ जाता है जिसके कारण ब्लीडिंग जो है वो स्टार्ट हो जाती है। और आर्तव धातु जो है वो हमारा मेन कंसेप्ट रहता है स्त्री रोग में। तो आर्तव इंडेक्स फिंगर का और रक्त धातु जो है हमारी रिंग फिंगर की। तो यहाँ दो जगह जब हमें स्पाइक मिलती है तो हम पेशेंट को जो है वो कुत्रग्नि योनि व्यापक के हिसाब से ट्रीटमेंट स्टार्ट करते हैं। ये कुछ पिक्चर्स हैं जो मैंने जब मैं क्लिनिक में पेशेंट अपने देखती हूँ तो जो मुझे स्पाइक्स मिलती हैं वहां जिस तरीके की, तो वो मैंने यहाँ शो की हुई है। रक्तजोनी, दिस इज ऑल्सो मेनोरेजिया। मेन दोष यहाँ पित्त वात मिलता है, लेकिन जो स्पाइक्स मिलती हैं हमें, जो स्पंदन मिलता है आर्तव धातु में, वो मिडल फिंगर पित्त, जो पित्त वाली हमारी फिंगर है, पित्त दोष की फिंगर है, उसके नीचे हमें स्पाइक मिलती है। रक्त धातु के नीचे रिंग फिंगर में स्पाइक मिलती है। और अपान वायु जो हमारे सब दोषार्य है, वहां भी हमें अपान वायु में वायु की या कफ की दृष्टि ना मिलकर हमें पित्त की ही, स्पाइक पित्त की दृष्टि मिलती है। और ये मोस्टली हाइपर एस्ट्रोजेनिक कंडीशंस होती हैं। जब एस्ट्रोजन लेवल कंट्रोल नहीं होता है तो रिकरेंट पेशेंट जो है वो ब्लीड करता रहता है। एमिनोरिया, व्हेन वी फील स्पाइक इन वेरी लो वॉल्यूम विथ वात, क्योंकि यहाँ अब हम गुणों की तरफ थोड़ा सा जाते हैं कि वात का भी एक रुक्ष गुण है। रुक्ष गुण की जब जब हम पेशेंट को चेक करते हैं तो वह हमें पेशेंट के अंदर कुछ रुक्षता का अनुभव होता है, तो हम वहां ये कहते हैं कि ये अराजकता योनि व्यापक के अंदर है। मेन दोष जो वहां मिलेगा हमें वात पित्त, लेकिन जो आर्तव धातु में जो हमें स्पाइक मिलेंगी वो वात और पित्त दोनों फिंगर्स के आर्तव के लेवल पे मिलती हैं। रस धातु में भी मिलती हैं, रक्त धातु में भी मिलती हैं, और यहाँ सभी जगह हमें वायु की ही, वात की ही स्पंदन मिलता है, क्योंकि वहां रस का भी क्षय हो जाता है, रक्त का भी क्षय हो जाता है, जिस कारण से पेशेंट को साइकिल नहीं आता है, या फिर हम बहुत बार ये कह सकते हैं कि हाइपो फंक्शनिंग ऑफ ओवरीज या हाइपोप्लास्टिक ओवरीज के जो पेशेंट्स होते हैं वहां हमें इस तरह की पल्स मिलती है। और अदर उपलूतन बहुत पेशेंट के जनरल प्रैक्टिस में गायनी में आते हैं। यहाँ मेन दोष कफ मिलता है, वात और कफ, क्योंकि पेशेंट जो है श्वेत प्रादर के कारण वीक हो जाता है, उसके शरीर का क्षय हो जाता है, मांस धातु का क्षय हो जाता है, तो वहां आर्तव धातु जो हमारी कफ फिंगर में है, रिंग फिंगर में, वहां हमें आर्तव दृष्टि मिलती है और वहां हमें कफ की ही स्पाइक मिलती है, वहां हमें पित्त या वायु की स्पाइक नहीं मिलती है। और दूसरा रस धातु का भी क्षय होता है, यहाँ हमें वात का स्पाइक मिलता है रस धातु के अंदर, रिंग फिंगर के अंदर ही दोनों जो हमारे एरियाज हैं, जैसे यहाँ रिंग फिंगर के जो लिटिल फिंगर की तरफ है रस धातु है और बीच में आर्तव धातु है, तो यहाँ दोनों जगह जब हमें स्पंदन मिलता है, कॉल्ड ल्यूकोरिया पल्स। सोमरोग, सोमरोग को हम बहुत बार कोरिलेट करते हैं इंसिपिडस डायबिटीज से। जैसे मेल्स के अंदर इंसिपिडस डायबिटीज है, देन फीमेल्स में इस डिजीज को हम सोमरोग कहते हैं। मेन दोष यहाँ वात और कफ होता है। स्पाइक जो है हमें वही कफ फिंगर के अंदर मिलती है आर्तव धातु में, बट इसके साथ साथ हमें मांस धातु और मेद धातु में भी स्पाइक मिलती है। देन वी कैन सेड कि दिस इज सोमरोग, दिस इज सिमिलर टू प्रमेह इन मेल। करनी सर्विसाइटिस, व्हेन वी फील वात और कफ स्पाइक अंडर इंडेक्स फिंगर, यहाँ भी मेन दोष जो है कफ और वात, क्योंकि ये सभी डिजीजेस हमारी योनि व्यापक के अंदर आती हैं, तो ये हमारे जो दोष हमें जनरली विकृति में मिलता है कफ और वात, या कफ दोष हमें मेनली विकृति में मिलेगा। पेशेंट जो है वो थोड़ा ओबीज होता है, और स्पाइक जो हमें यहाँ मिलती है वो कफ फिंगर के जो है मिड वाले आर्तव धातु पे ही हमें मिलेगी, साथ में हमें रक्त धातु की भी स्पाइक पे यहाँ हमें कफ या वायु की एक स्पंदन मिलता है। बार्थोलिन एब्सिस, बार्थोलिन एब्सिस मेन दोष यहाँ वात पित्त और वात कफ। स्पाइक जो है इंडेक्स फिंगर में हमें फर्स्ट फिंगर के अंदर मिलती है, रस धातु में मिलती है, रक्त धातु में मिलती है, मांस धातु में मिलती है। फाइब्रॉइड, फाइब्रॉइड्स में मेन दोष कफ वात और कफ पित्त होता है, जहाँ ब्लीडिंग ज्यादा है वहां कफ पित्त दोष के साथ पेशेंट आता है। क्षय होता है, एमिनो जाता है, वहां कफ वात के साथ विकृति में आता है। धातु की फिंगर के नीचे आर्तव धातु पे मिलती है, साथ में जो हमारी पित्त प्रकृति की जो फिंगर है उसमें मांस धातु में हमें से डर्माइटिस, सेम कफवात और कफपित्त विकृति, आर्तव धातु, रिंग फिंगर, लेकिन यहाँ थोड़ा सा चेंज है, फाइब्रॉइड में मांस धातु में विकृति है, और जब हम डर्माइटिस देखते हैं तो वहां मेद धातु के अंदर दृष्टि है। रक्तज ग्रंथि, मायोमा, मेन दोष कफवात कफपित्त ही रहेगा। स्पाइक जो यहाँ है वो कफ फिंगर में आर्ता दृष्टि पे मिलेगी, लेकिन साथ में रक्त धातु में भी हमें स्पाइक मिलती है। पीसीओडी में बहुत सारे चेंजेस आते हैं, तो अलग अलग तरीके से हम अपना डायग्नोज बना लेते हैं। मिक्स स्पाइक होती है पीसीओडी की, एनोविलर पीसीओडी होता है, बात की हाइपोवॉल्यूमिक ओवरीज होती है, वहां की स्पाइक चेंज हो जाती है। इंटरप्टेड ब्लीडिंग विद पीसीओडी होता है, वहां की स्पाइक चेंज हो जाती है। डिप्रेशन में स्पाइक चेंज हो जाती हैं। तो पीसीओडी के लिए हमें अलग अलग नाड़ी परीक्षा से डायग्नोज बनाने होते हैं अकॉर्डिंग टू पेशेंट और पेशेंट ट्रीटमेंट। नाड़ी परीक्षा के साथ लर्निंग इज शेयरिंग, इट इज जर्नी इन्वेस्टिगेशन टुगेदर एवरी मॉर्निंग, when you walking feel your own pulse, be your own healer, be your own doctor और वैद्या। अब मेरे कुछ एक्सपीरियंसेस हैं वो मैं आपको शेयर करती हूँ। राइट फॉलिकुलर पेशेंट इज ऑफ इनफर्टिलिटी। तो हमने जब इसकी प्रकृति देखी तो वहां वायु और पित्त समान थे, लेकिन कफ की मात्रा ज्यादा थी। प्रकृति में वायु है जो है वो बढ़ गया है, और कफ जो है कफ का क्षय हो गया है। तो हमें इस तरह से जो है दोष की जो प्रकृति है ये मिलेगी। यहाँ उदान वायु में दुष्टि थी, समान वायु में दुष्टि थी, रस दुष्टि थी, आर्तव दुष्टि थी, मांस धातु में दुष्टि थी, गॉल ब्लैडर में भी इनको विकृति की पल्स थी, वायु की पल्स, कुछ पित्त की पल्स थी, और वहां कफ दुष्टि भी थी। तो यहाँ इनको पेशेंट को जब हमने डायग्नोज के लिए भेजा, स्कैनिंग के लिए भेजा, तो उसको गॉल स्टोन आया ड्यू टू गॉल ब्लैडर और समान वायु दुष्टि। फॉलिकुलर सिस्ट आई ड्यू टू कफ वृद्धि, कफ इन विकृति एंड पित्त वृद्धि, क्योंकि पेशेंट को बार बार रिकरेंट पीरियड्स आ रहे थे, तो वहां रस दुष्टि थी, आर्तव दुष्टि थी। तो यहाँ से हमने पेशेंट का एक डायग्नोज बनाया। तो पेशेंट जब हमने उसको कहा कि नहीं तुम्हें फॉलिकुलर सिस्ट हो सकता है, तो पेशेंट नाउ शी इज प्रेग्नेंट। ये दो पेशेंट्स हैं। अब आप ये देखिए चेंजेस दोनों ही जो है ओवेरियन सिस्ट के हैं। एक को राइट ओवेरियन सिस्ट है, इसको एक को लेफ्ट ओवेरियन सिस्ट है। प्रकृति देखिए, एक में वायु 2 है, पित्त 2 है, कफ 3 है, और हमारे पहले पेशेंट में भी वायु 1 है, पित्त 1 है, कफ 3 है। लेकिन विकृति में वायु 1 है, पित्त 2 है, कफ 2 है। तो वहां विकृति जब हम देखते हैं तो मेनली कफ का क्षय या कफ की वृद्धि हो रही होती है। और जो पहले वाला पेशेंट था वो हाइपोथायराइड भी था उसको, क्योंकि वहां पे आपने देखा उदान और समान में विकृति है। सेम यहाँ है, उदान बाद में विकृति है, साधक पित्त, तर्पक कफ, रस दुष्टि, आंतों में कफ दुष्टि, और लार्ज इंटेस्टाइन में थी। तो उस पेशेंट को आईबीएस से, तो ये थोड़ा सा हमने यहाँ डिफरेंशियल डायग्नोज बनाया दोनों पेशेंट्स का। तो हमें यहाँ से एक आइडिया मिलता है कि नहीं पेशेंट को हमें क्या कहना है। तो जब पेशेंट वापस आता है तब मैंने इसमें बाद में लिखा कि नहीं इस पेशेंट को हम ऐसे शो करते हैं। तो यदि हमें इस तरह की विकृति मिलती है तो हम डायग्नोज बना सकते हैं। पेशेंट है उसके भी थोड़े केसेस हैं कि उनके रिपोर्ट्स मेरे पास अवेलेबल है। तो प्रकृति जो है आप देखिए वायु 2 है, पित्त 3 है, कफ 1 है। विकृति में वायु 2 है, पित्त 3 है, दोनों बैलेंस है, लेकिन कफ बढ़ रहा है, उदान और समान में है, व्यान वायु की दुष्टि है, तर्पक कफ की दुष्टि है, और दूसरे में रस और मेद धातु में दुष्टि है। दूसरा केस था वहां भी प्रकृति में वात और पित्त सेम है, लेकिन कफ वृद्धि, कफ का क्षय है, उदान और समान में दुष्टि है, रस और मेद धातु में दुष्टि है। तो वी कैन सेट दिस इज हाइपोथायराइड। ऑपरेटेड गॉल ब्लैडर, यहाँ वायु का क्षय है। तो इस पेशेंट को गॉल ब्लैडर में स्पाइक थी, यूट्रस में फैट भी था, लिवर में स्पाइक थी, समान वायु की दुष्टि थी, दूसरे में मांस और आर्तव धातु में थी। तो यहाँ इस पेशेंट की कोलेसिस्टमी हुई थी, फैटी लिवर था, और पेशेंट को फाइब्रॉइड भी थी। ऐसे ही ये फाइब्रॉइड यूट्रस की है, लार्ज इंटेस्टाइन में स्पाइक थी, समान वायु दुष्टि थी, व्यान की दुष्टि थी, अवलंबक कफ की दुष्टि थी, दूसरे में जानते रक्त और मांस अस्थि और आर्तव। क्योंकि पेशेंट की कंप्लेंट्स में था हैवी ब्लीडिंग थी, हाइपर एसिडिटी, बैक पेन, फाइब्रॉइड यूट्रस, 3 to 4 टाइम्स ऑफ मोशन। तो यहाँ से हमने फाइब्रॉइड के जो लिया वो हमने आर्तव दृष्टि ली, रक्त दृष्टि ली, मांस दृष्टि ली, और वो रिंग फिंगर के अंदर थी। तो यही मेरा एस्पेक्ट था बताने का कि हम यहाँ से फाइब्रॉइड यूट्रस को निकाल सकते थे। थैंक यू।
Thank you, ma'am. It was really nice session, and I congratulate you. As I think just एक क्वेश्चन में पूछूंगी because like time को देखते हुए कि नाड़ी वैद्य आपने मतलब नाड़ी वैद्य को आपने establish किया है स्त्री नाड़ी वैद्य करके, तो what are the difficulties in your journey? Can you share just within a minute?
मैम बहुत सारी
कुछ
डिफिकल्टीज
आपको
तो आई,
दिक्कतें आई
क्योंकि
होगी because
आज भी जो है कोई भी नाड़ी सीखने के लिए तत्पर नहीं होता है। पहले तो यही डिफिकल्टी रही, बट ये है कि कोई बात नहीं, मैं अपना काम करती चलूंगी। कभी तो बच्चों को ये लगेगा कि जब वो पेशेंट देखने में या ट्रीट करने में जब उन्हें डिफिकल्टीज आएंगी, तब उन्हें लगेगा कि नहीं, हमें नाड़ी परीक्षा की जरूरत है। क्योंकि वहीं से वो निकाल पाएंगे कि अगर उनके पास फाइब्रॉइड का ही पेशेंट है और उनको वो वात पित्त के हिसाब से ट्रीट करते हैं, तो उनका पेशेंट उलझ जाता है या वो क्योर नहीं होता। तो तब उन्हें लगेगा कि नहीं, हमें नाड़ी परीक्षा आनी चाहिए। तो थोड़ा टाइम और लगेगा नाड़ी को आगे बढ़ने में। और अभी मैम जो भी है इंस्ट्रूमेंट्स बहुत बन रहे हैं नाड़ी के ऊपर, बट हम चाहते हैं कि ऐसे इंस्ट्रूमेंट्स बने जैसे रेडियोलॉजी में हम स्कैनिंग कराते हैं और हमें वहां शो हो जाता है कि नहीं, दिस इज फाइब्रॉइड यूट्रस, दिस इज पॉलीसिस्टाइटिस, पॉलीसिस्टनी, जो भी है। तो वैसे ही हम चाहते हैं कि हम पेशेंट को ये कह सके कि नहीं, आपको ओवेरियन सिस्ट है, आपको सर्विसाइटिस है। तो ऐसे इंस्ट्रूमेंट्स बनाए जाएं जिनसे हम ये डायग्नोज बना सकें। वेव से मैम डायग्नोज नहीं बनता, पेशेंट भी जो है या वैद्य भी जो है वो कंफ्यूज होके ही रह जाता है। और बस डिफिकल्टीज तो यही है कि कोई भी सीखने के लिए एग्री नहीं है अभी, बट जो आयुर्वेदिक प्रैक्टिस करेंगे वो सीखेंगे भी।
यस मैम, श्योरली सीखना तो चाहते हैं, बट जो डेडिकेशन चाहिए होता है, जो एक लगन चाहिए है, एंड मतलब पेशेंस भी चाहिए होते, वो थोड़ा सा लैकिंग होते हैं हम लोगों को। रिजल्ट और इंस्टेंटली सब कुछ सीखना एंड बोलना होता है। सो थैंक यू वेरी मच मैम। And moving with this, our next speaker, I would like to welcome Dr. Nirmala Suvalji from Nepal. And welcome, ma'am, on this platform. Madam is our regular, connected with our this family. And welcome, ma'am. She is practicing in Nepal. And today's topic is trichology, because I think trichology may be a woman का अपना एक ये होता है. And so she will try to put up her views on trichology in Ayurveda. Welcome, Dr. Nirmala ji. How are you?
Namaste, I'm good. Namaste. Myself,
After
Dr.
long time. Yeah.
Yes, ma'am. Namaste. Happy International Women's Day to all the everyone listening to Ayush Darpan Foundation today. So myself, Dr. Nirmala Suval from Kathmandu, Nepal. So I have been the regular listener for Ayush Darpan, and so for last few years, I'm practicing Ayurvedic trichology. So today on this international platform, I would like to talk on Ayurvedic trichology, scope of Ayurvedic trichology, and its entrepreneurship. Ma'am, I would like to share my screen.
Yes, sure. Yeah, just a minute. Yes, ma'am, sure. कीजिए आप share. Yes, option is there. You can share, ma'am.
Okay. Is my screen visible, ma'am?
Yes. Continue. Please continue.
Okay, so I would like to start my presentation for today. So my topic for today is Ayurvedic trichology and its entrepreneurship. Myself, Dr. Nirmala Suval from Kathmandu, Nepal. I have done my BA/MS from the Government University of Kathmandu, Nepal, and I have done certificate course in Ayurvedic trichology and dermatology, postgraduate course in cosmetology from Maharashtra, India. So before talking about this trichology, I would like to give some scenario. So many Ayurvedic allopathic clinic and aesthetic clinics on hair and skin has been established in Nepal. So they are mushrooming, and their main focus is on PRP treatment and hair transplant, which is a big business over here. Over that, many Korean and Japanese cosmetic brands and clinic are also opened, and some Thai products for hair care is also available, and different national and international hair care products are also available throughout Nepal and India. I also think so. Many international brands and many national brands are available, but Ayurvedic brands or herbal brand are not so common in Nepal in case of hair care products. So why Ayurvedic trichology is required? So I would like to give some background over here. So initially people visit Ayurvedic clinic for any type of hair problems, or they use some home remedies, or maybe Ayurvedic oil, or maybe the hair pack for these issues. But there are no proper Ayurveda clinics which are well equipped to solve all the trichology problems. And many Vaidyas are also unaware about the scope of Ayurvedic trichology. So what further things can be done instead of Ayurveda oil or hair packs or internal medicine, what panchakarma can be done, or what type of other therapies can be done to improve the condition of hair loss in many patients. So these type of things are also not in awareness in many Vaidyas. And also the main thing is many Vaidyas are just busy in the clinical cases or different types of diseases or big diseases, so they take this trichology as a small part of Ayurveda. But we have to think in a bigger way for the trichology. And then so this Ayurvedic trichology is just limited to the hair oils or internal medicines or lepers or sirodhara or siro-offenga. So whenever the patient visits for the hair fall treatment, so mainly the prescription will be the hair oils or maybe some internal medicines or maybe directly the sirodhara or siro-offenga. But this is not the proper solution, so we have to go in details, and many more things can be done in case of hair fall. And then in recent times, some fellows have started some panchakarma procedure and prachana karma for the hair fall treatment, but this is also not a specialized Ayurveda hair clinic. External Ayurveda treatment may not meet all the requirements of various different types of trichology problems. So maybe we need to go internally, or maybe we need to do some advanced machinery treatment with the use of the herbs, with the use of our lepers for the proper treatment of the patient. So finally, due to this improper treatment or not the full treatment, patient may end up in visiting and taking modern treatments. But I have already mentioned that from my clinical practice, what I have found is people generally love to visit Ayurveda clinics or love to take Ayurveda treatment before visiting any modern treatment. So we have a big chance to practice Ayurvedic trichology. So for being a healthy person, there should be a healthy hair. So this is not my version. So this is given by Acharya Bhagavata. So Acharya Bhagavata, while describing the Uttam Sharir Lakshana, he has given the Subha Lakshan of the Uttam Kesa, that is the Susnigda Mritava Suchma Naika Mula Stira Kacha. So the hair which is very silky to touch, soft, which can be separated from the roots, or which is not tangled, or which has the strong roots, is considered to be the best hair. So in this way, Acharya Bhagavat has given the definition of Uttam Kesa in Subha Lakshana Yukta Sarira in the Saristhana of Astanga Hridaya. That means for making someone healthy, there is the vital role of healthy hair. That means for making someone healthy, being a trichologist, we have a big role for making someone or person healthy. So I would like to give some background about hair distribution and the site of dosa. So this frontal part of hair is the site of vata. So whenever the patient comes with the hair fall, so if there is the hair fall, you can see in the frontal area, this frontal part, then we should think about the vata imbalance. So maybe due to the stressful condition or maybe the lack of sleep. So due to that condition, there is frontal hair loss. So we have to take vata in consideration, and we need to treat in that way. Then second part is the crown area, this parietal area. So this parietal area, this is the site of pitta function. So if there is any imbalance of pitta, then we can see the crown hair fall. Then lastly, this occipital area, the backward of this crown, this skull area. So this is the site of kapha. So kapha being the mother of the hair, or which generates the hair. So normally the occipital area hair doesn't fall. So most of the patient, they come with the hair fall complaint over the vata area or the pitta area, but kapha area is not much common. But in case of alopecia areata or in other autoimmune diseases, this can be found. So what is the normal phenomena of hair loss? So anyone, men, women, and children, they can experience hair loss. Most people normally said 50 to 100 hairs a day. So 50 to 100 strands falling is normal for every people. Since new hair is growing in at the same time, it doesn't cause noticeable thinning of scalp hair. And hair loss occurs when this cycle of hair growth and shedding is disrupted, or when the hair follicle is destroyed and replaced with a scar tissue. To go in detail, so we need to know little about the hair cycle. So in hair cycle, so hair cycle is mainly divided into 3 phases. So anagen phase, catagen phase, and telogen phase. Anagen phase, which is the growth phase, in this there will be the nourishment of hair fall through the blood supply, and it helps in the hair growth. Then catagen phase, which is the transition phase, so the hair follicle detaches from the nourishing blood supply, in it start to become dead. And lastly, the telogen phase, which is the resting phase. So there won't be the proper nourishment of the hair, and hair starts to dry and falls out. So the hair cycle, the first one, the anagen phase, which is the active growth phase, the duration is 2 to 6 years. And then catagen phase, the transition phase, in which years transit and starts to fall. So the duration is 1 to 2 weeks. And then the telogen phase, the last phase, which is the resting phase, so the duration is 2 to 4 months. And this, after this, for these 3 phases, the hairs again return to the anagen phase, and this dermal papilla moves upwards to meet hair follicle once again, and the hair matrix begins to form a new hair. So this is the this is the hair cycle which we need to know. Let's know some causes for the hair loss. So mainly the medical conditions like the thyroid problems, or maybe the diabetes or hypertension or cancer disease, or even the fever. So the fever related with the dengue or COVID. So this type of medical conditions also causes the hair loss. Then the medications, poor nutrition, which leads to the deficiency in multivitamins. This also causes the hair loss. Then age, pregnancy, in which there will be the hormonal changes and massive hair loss can be seen. Then some infection and stress. So stress is very important factor for the hair loss. So stress and hair loss is directly proportional to each other. So when there is stress, there will be hair fall, and due to hair fall, again there will be stress. So stress is very important cause of hair loss. Then genetic causes, then the hair treatment and styling, which is the main causes for this area. So females and males who undergo many types of hair treatment and styling, coloring, they have this type of hair loss. And then, so I have divided the causes of hair fall in mainly 4 branches. So the hormonal causes may be maybe due to the thyroid imbalance or high testosterone, DST factor, PCOS, insulin resistance, estrogen dominance, or high cortisol. So high cortisol is due to the stress. And then micronutrients deficiencies like the vitamin B12, biotin, iron, zinc, lack of protein, and then environmental like the heavy metal, toxicity or chemical treatments, and then autoimmunity, so mainly the alopecia areata and other autoimmune diseases. Here I would like to focus more on the stress. So stress, as I told you, so this is the very important cause of hair fall. Stress causes the hair fall, and again, this hair fall, due to hair fall, again the stress increases. So stress should be taken in consideration, and we need to treat the stress from before. So stress appears to be excessively stimulate our androgenic hormones. In times of stress, our hair's anagen phase abruptly shifts to catagen phase. So in normal hair, at least 85% of hair is supposed to be in anagen phase at any time of point, and then only 1% transition to catagen phase. So from growth phase, it goes to 85% of hair. They suddenly transfer to the transition phase and starts hair falling. So as a large proportion of anagen phase hair shifts abruptly to the catagen phase, this ratio is altered in times of stress. So this causes sudden loss of much larger amount of hair. So in our OPDs, so common diseases seen so related to hair, so mainly the interloped khalite, palite, darunak, telogen effluvium, alopecia, androgenic alopecia, that is male pattern baldness, female pattern hairless. So this type of problem can be seen. So Khalite, this is the Ayurvedic approach. So mainly the Pitta dose is involved over here. So we have to think about the Pitta dose samprapti, and then two theory has been described, mainly the Pitta one and the Pitta related with the Vata. So we have to take in consideration both Pitta and Vata, and this both are main causes or makes the samprapti. So we have to do samprapti begotten of both Vata and Pitta over here. So this is the hair loss, so female pattern and male pattern in comparison we can see. And then the main tool for trichological practice is the trichoscope. So this is the professional and reliable dermatoscope to assess the active hair or scalp condition, as well as to examine the area for symptoms, risks, and promote early detection. So this is the main tool for the hair examination. So when we check through the trichoscope, we can see the hair follicles like this, hair roots. So in general, so whenever we examine the hair roots, so from one hair root, generally in a healthy person, we can find at least 5 to 10 numbers of hair in a same hair root, same follicle. But when there is hair fall, we can see only 1 or 2 hair remains, and there will be a much distance apart. 2 hair follicles are very distant apart in a hair fall patient. And after the treatment, after our treatment, so when after doing Ayurvedic treatments, and when we check the hair through our scalp through the trichoscope, we can see the hair sprouts like this. So this is the patient female pattern baldness. So after the treatment, we can see this type of the hair follicle being developed. So some blood investigation which we need to say, so complete blood count, the blood sugar, serum calcium, serum ferritin, vitamin B12 and vitamin D, which is the main factor for hair fall, and testosterone and TFT as well. So this should be taken in consideration. So I would like to correlate here one thing. So here is the byproduct of Asthi Dhatu. Okay, so hair and nails, they are the byproducts of the Asthi Dhatu. That means if our bone is not properly nourished, then there will be problem in hair and nail. So in the same way, modern science has also described, so deficiency in vitamin and calcium, it causes the hair fall. That means, so both in both way we can correlate for the hair fall, the calcium deficiency, the vitamin D deficiency, and the osteoporosis, they can be correlated in case of hair fall. So in case of treatment approach, so mainly the medical treatment, as I have already mentioned, so main is the stress management. So from day one of our treatment, we need to focus on the stress. We can give different methods, the ways like the Brahmi, Jatamansi, Vacha, Sankafusmi, Yastimadu, or some medicines like the Saraswata Rista, Manas Mitra Batak, or Ashwagandha. It can be used it can be prescribed according to our availability. So in my experience, experience, so Saraswata it has given me good result, and in many of the hair patient who smokes or who drinks regularly, so this use of Saraswata has shown good results in case of smokers and drinkers as well. So people has decreased the rate of smoking and drinking also. So stress management plays a very, very important role in hair fall treatment. And then mainly those are involved is the pitta. So pitta samak chikitsa should be done, and then amupasan chikitsa, vatanuloman chikitsa, srotas chikitsa, dhatu chikitsa, and lastly the rasayan chikitsa should be done. And then talking about the very important therapy, so mainly the external therapy like the kurcha chikitsa, I will go in details. So kurcha chikitsa should be done, prachana karma can be done, lepo chikitsa can be done, coping therapy, and then leech application should be done. So leech application, which is very fascinating and which gives very results, which gives very good results. So it should be done, and lepo chikitsa it should be done. So Kursa Chikitsa, so Acharya Bhagavat has described Kursa Chikitsa in the Astanga Hridaya Sutrasthanam chapter 26, slok 22. So where he has described Kursa as it has a circular brush with sharp round spikes fixed on one end, which is 7 or 8 in number and fastened well. So the length is 4 angula. So Kursa Sastra is indicated for scraping in Nilika, Venga, loss of hair, Indralupta, and Sutra. So Acharya Bhagavat has clearly described about this Kursa Yantra, so which can be correlated with Dharma roller of the modern era. Okay, so mechanism of Kursa. So when we use this Kursa or this Dharma roller, so micro punctures are created using the micro needles, which produce a controlled skin injury without actually damaging the epidermis. So there is no damage in the epidermis. So these micro injuries lead to minimal superficial bleeding and set up a wound healing cascade with the release of various growth factors. So needles also break down the old hardened scar and allows it to revascularize. So when the hair follicle dies, there will be the hardened scar. So that hardened scar can be broken down by the needles of the Kursa Yantra. And then Kursa Sastra helps to stimulate reactivation of hair growth cycle, resulting in better hair growth and facilitated hair fall reduction. So along with Kursa Chikitsa, we can also do the Prachana Karma. So Prachana Karma, I would like to show a small video. So we can give a small puncture over the affected area by using the 22 gauge needle or 24 gauge needle as per the requirement. So Prachana Karma is a type of Rakta Mokshan described by Acharya Sushrut, and then it helps in clearing the Romakupas, and vitiated Rakta can be expelled out through the Prachana Karma. So nowadays surgical blade and needles are used for pricks, followed by the application of different labors like the Gunja seed, Neem, Triphala. So labor, it helps very important role. So in my experience, the labor from the Gunja seed, Neem, Triphala, it helps to develop the hair follicle. So labor chikitsa is very, very important. And then the main thing is the panchakarma. So we can do various type of panchakarma. Panchakarma sodhan is very, very much required for getting the proper results of vamana. We can do then virechana, being the pitta, being the main dosa involved over here. So virechana should be done, and then nasya can be done. Nasya should be done. So for any type of ENT diseases or Jatrugat roga, we can do nasya, so which gives a good result. So Bringaras Soros can be used, or Onutel, or even Sadbindutel can be used. So Sadbindutel, because it contains the Bringaras, so we can perform nasya by use of Sadbindutel as well. Then Rakta Mokshan by the use of leads, coping, Rakta Mokshan can be also done. And then very important role is played by the Vasti. Tikta Chir Vasti can be done. So Vasti can be done at last to improve the quality of the hair and to make the hair permanent. The Tikta Chir Vasti, it plays very, very important role. And then some in case of panchakarma like the Shiro Ovinga, Porisheka, Shiro Dhara, Takra Dhara, Nasya, Shiro Pichu, Shiro Labor can be done. So there should be some lifestyle changes behind us. So mainly we need to reduce stress and anxiety through pranayama or yoga exercises. Then deep relaxation using savasana or yoga nidra is required. And then hair washing can be done by the amla, sikakai, or herbal shampoo. So shampoos should be also taken in consideration, because nowadays mainly the sulfites in the shampoo, it causes the hair damage and the scalp damage. So herbal shampoo should be used. And then hair loss can be prevented by oiling and massaging the scalp. So proper coconut oils can be used for massaging the oil. And then regular bowel movement, that is very much important. That is the gut health is very, very important. Then increase in blood circulation and activation of sebaceous gland can be obtained by rubbing the scalp after hair wash. So hair wash on proper time and rubbing the scalp is very important. And very important thing, in case of dandruff, if there is oily dandruff, we need to avoid the hair oiling or shiro vinegar. And if there is too much dandruff, so dandruff can be examined through this trichoscopic examination. So if there is too much dandruff, then we need to wash hair regularly, and we need to get exposed to the sunlight to get rid of the dandruff. And then some modern treatment can be used. So along with Ayurvedic treatment, we can use some modern medicine like the deep hydrogen medicine to take out the dandruff. Okay, and then UV light to treat the accumulated oil. Then laser combing can be used. So it controls the sebum secretion, and it helps to make the scalp healthier. And then infrared light can be used. Scientific combing, so which is the proper way of combing the hair, it should be done. And then laser combing should be done. Exposure to the IR light, which increase the vasodilation, it can be done. Vibrator machine can be used. And derma roller, so which I have correlated with the kursa yantra, so kursa chikitsa can be done. So while doing the derma roller, we can use the alcoholic extract of the bringaras, currants, gunja, kumari, dhatur. So this type of herbs help to stimulate the hair follicle to produce the hair. So this type of alcoholic extract can be used after doing the derma roller. So then we need to think about the hair food also. So base proteins like the soya, rajma, lentils, beans on weekly basis should be taken. And non-veg proteins like the white part of the egg, the chicken, so they also plays a very important role for development of the hair. Then consumption of saturated and unsaturated fats is very much required. And I prescribe special combination of the superfood, that is the sunflower, flaxseed, watermelon, pumpkin seeds, black sesame seeds. So this type of seeds should be taken once Dipan Pasan is finished and Vatan Luman Chikitsa is finished. We can prescribe patient this type of superfoods. And then multivitamins, especially vitamin B12 and B6 for promotion of health, vitamin C for sebum production, and vitamin E for maintaining scalp health. So this type of proper vitamins should be given. And then in case of minerals, iron and folic acid, it should be given. Daily intake of milk is very, very much required, and different types of dry foods should be given. And then antioxidants, PABA. So this type of food should be prescribed. So this is the combination of the superfoods. So we can see the picture of the black sesame seed, flax seed, this watermelon seeds, sunflower seed, and pumpkin seed. So this has high content of the protein, so which helps in the proper hair follicle development. So this type of seeds should be taken on regular basis. And then for being healthy, so what we could do is for making our hair healthy on regular basis, we can do this Ayurvedic hair spa. So I have given presentation for the Ayurvedic hair spa before also. So for details, you could visit that. You could watch that from the YouTube channel of Ayush Darpan. So Shiro Obenga we can do from the proper oil like the Triphala oil, Yastimadu oil, or whatever oil is suitable according to to the condition. If there is dandruff, we can do it the Datur Patradi oil, and then Sirupichu can be done with the same oil. So Sirupichu can be applied for 20 to 30 minutes, and then scientific combing should be done. So it will be better if we could do scientific combing every day, at least 2 times a day, with the neem comb or bamboo comb or any kind of wooden comb. Then Siro Sweden can be done by the use of the herbal decoction, Talam, Talaporichil, and Kesa Dupana. So Kesa Dupana, it helps to take out the dandruff. It helps to fumigate all the dandruffs or fungal infection and bacterial infection from the scalp. And then lastly, Kesa Prakshalan can be done by the use of the triple IST-Madhu or Sikakai. So the decoction can be used. So this type of, if we can do this Ayurvedic hair spa once a month also, we can get a very healthy hair. So these are some pictures of hair spa. So Sirovinga, Siropichu, this Talam, Kesa Dupana. So this can be done. Kesa Prakshalan, this can be done. So Ayurvedic trichology is not only simply the clinical practice. So this is also a big entrepreneurship for any Ayurvedic Vaidya. So we can produce herbal shampoos, we can make hair serums, hair gels, or hair oil for gray hair or hair fall or dandruff problem, or hair packs according to the condition. If we Vaidyas do not do this type of thing, then the people from outside the Ayurveda fraternity will do and will grab all the opportunity for this entrepreneurship. So we need to think on time for this type of the cosmetic production. So this is my hair shampoo, the picture of the hair shampoo, making of the hair shampoo. So these all things are available in my personal YouTube channel also. You can also view, you can also visit the YouTube channel. Then this is the hair oil preparation for the gray hair problem. So I have made oil from the marigold flower. So marigold flower mixed with the black sesame oil. I have done the copper methi, and I have grounded it for 3 months. So after 3 months, you can see this golden oil. So this golden oil can be used for the hair fall treatment and for the gray hair. And then this mussy preparation from the narikal, this is mainly the narikal mussy. So this can be used for the hair loss and for growing the new hair, and also for it can be used as the black hair. So I would like to show some of my cases. So this is the case of the 31 years old male. So this case is very interesting. So because he has done only 1 or 2 times leech application and done the internal medication. So after 3 months, he came with this hair, and he is very busy person, so he couldn't continue all the treatment. But I got very good result with this, even with the simple leech application and with the internal medication. So here, this is the another very challenging is the hairline restoration. So in this case, so I have done several sitting of the leech application and Lepo application with Kutsa Chikitsa, then woman and Viresan. So I have got the results. So front line here we can see before and after. So this is the example of the female hair loss, so female pattern hair loss. So this application you can see, and then result you can see. So this is the 46 years old female. So she is diabetic, she is hypertensive, and she is on thyroxine medicine. But again, we got the result. So this is the typical pattern of male pattern baldness. So the result was found after 3 months of the treatment. So this person, he mainly did the Kursa Chikitsa with the Lepo application and leech application, so we can get the proper result. And so this is also the whole frontal area and crown area is lost over here. So we got the result after 3 months of the proper treatment. And this is the alopecia areata case. So before and after, you can see some patches, some round patches in the before picture, and then after. So this is seen after 4 episodes of the leech application. So the same patient, you can see it as before there was less hair in the right part of the head, and in the left part you can see in after you can see the result. So in the same patient, you can see the loss of the eyebrow also. So after this application, we got this result. So this is the typical female pattern of hair loss. So leads application, kurcha chikitsa, woman beads, and everything was done, and result was seen. So this is the male pattern hair loss. So before and after, you can see. So this is very challenging case for me. So there was crown hair loss. So crown hair loss is mainly related with the pitta. So pitta samak chikitsa was done for 6 months actually. So this result was in only after the 6 months. So you can see the crown area is growing. There is thickness in the crown hair. So this is also the thinness of crown hair. So after you can, in after picture, you can see the result in the crown hair. So this much for today. Thank you so much for your time, and thank you so much for listening me. If there is any queries, I would love to share my knowledge. Thank you so much, ma'am.
Ma'am, thank you for your this elaborative knowledge of trichology. Thank you. But due to as we are lacking of time and running out of schedule, so we will take question answers in the next session. And I would like to invite Dr. Tejaswini Madam, Dr. Tejaswini Bhale Borse Madam, and she is the founder and head physician at Prakruti Ayurveda and Panchakarma Clinic Pune. And also she is working as a consultant at Atre Innovations in Pune, teaching faculty for International Academy of Ayurveda, IAA, since 2006. And so welcome, ma'am. She is also MBA and PGPP diploma in yoga, and very versatile personality with us. And her topic is innovations and research opportunities for, I think, women's mostly. So welcome, ma'am. And sorry for the late. And this is the last one. Okay. Thank you.
Thank you. Thank you very much, ma'am, for such a nice introduction. And may I request doctor who presented first to stop her presentation? Yeah, great. Thank you. Okay. So as ma'am told you that I'm working as an Ayurvedic physician, and I'm practicing in Pune for last now 19 years. And working, my practice is mainly related with the women's health and lifestyle disorders. Also, I am associated with a tech company, IT Healthcare, which is Atre Innovations Private Limited. And there I work as a domain expertise for Nadi Pariksha, and also for the Jiva Pariksha, and a few more things which are including in our tech version. So today's my topic is, as ma'am said, about is for the research and innovation, because earlier seminars I talked about Nadi Pariksha. So now what is the new thing that we can include in our career life? And as this is a very good event of Women's Day, how we can broaden our career with new dimensions of research and innovative products that I will discuss with you today. So let me share my screen also. Yes. Can you see my screen? Is it visible clearly? Shilpa ma'am? Hello? Hello? Hello?
स्क्रीन नहीं दिख रहा है मैम.
Okay, but the meeting is going on. I couldn't see anything over here. Okay, let me check it again. Share screen. Now is this visible?
Yes, ma'am.
Okay, thank you. Great. So let me start with my session about the research and innovation. So let's moving towards the first slide, which is my journey as from a hardcore Ayurveda practitioner to a researcher, how it started. So as I mentioned, I'm practicing Vaidya in Pune. And as I learned from a very renowned institute in Pune, which is Ayurveda based, that is the Tilak Ayurveda College. So my practice was completely with the fundamentals of Ayurveda. And in the beginning, what the thought came to my mind, as many of you have, them, why to do research in Ayurveda? Our science is already proven. Our ancestors, our sages, our all the ancient text. Sorry, is there any disturbance? I'm hearing some noises. Kindly mute yourself. Okay, so is there any need why to do the research for Ayurveda? Because it is already a proven science. That the thoughts came to my mind when I was in a college time or my education level, and also for the initial years of my practice. But and also along with that, why I want to prove my science for the acceptance from the Western medicine? That the first thoughts came to a Ayurveda student or the practitioner. But there is a big but now. But the research is a need of the time. As I said, as I gone through all these stages in my life, in my career also. So very first of all, the research is needed for the awareness creation. And we can make that awareness about the Ayurveda fundamentals through our case studies, which is very helpful. That it is not going to prove Ayurveda case studies or our science, but it will help to know people about, yes, Ayurveda is also having the scientific background. Then very importantly, the next comes is the standardization of our medicines. We know we have a different text, and we are having thousands of medicinal formulations from our text. But standardization is very important. And as we practice today, not only in India, but when we do practice or we treat patients from the Western countries or here also in India, there are many people who ask for the standardization or the purity concerns. So this R&D is very important for the medicines and for our treatment parts. As the doctor presented her PPTs for the hair loss treatment. So she is having this documentation. But if she present this one, or she will do all this case study in a scientific way, that will give more and more weightage to the treatments, the standardization of treatments, and also acceptance from the society. So standardization is very important. And as the research, every research is having a main motto, that is the well-being of a mankind, and which should be for the public health. So our each and every research should go in this direction. Then only that research is acceptable by the whole, I will say, the nation and by the globe. So in this way, I have changed my thoughts. The thoughts change, and from this point, as a researcher, my journey started. So now, why this Ayurveda? Ayurveda is, as we know, that it is a predictive science, it is preventive, it is curative. But now today we want all these things in the today's language, which should be sustainable, which should be accessible, and which should be affordable. And that's why the tech part comes in the Ayurveda, and technology, using technology up to the correct limit, that will help us for the diagnosis also, the predictions also, and for the curation, the cure of the diseases. So in that way, the Ayurveda is now got this support, I will say, or Ayurveda and technology are now going together in hand. So why this research comes in the thought that only the paper presentations or writing the papers or their submissions is not the research. So need is of a contemporary Ayurveda, that we have to prove the Ayurveda, not I will say, I will take these words back, that we have to give the expression of Ayurveda in today's language. The today's language is of evidence based. We know we all having text references. We examine our patients in our clinics and we have our own observations. But when you will prove it, when you will show it to the audience, that will create a evidence. So for the research is mainly needed for the evidence base, which is the need of the time. Also, it improves the access and quality of public health delivery. It helps in the promotion of health and prevention of diseases. The research and development part is also important for the contemporary Ayurveda. Interdisciplinary research is very important, that not only with Ayurveda paternity, but with the modern medicine or with the some allied naturopathy things or yoga, I will say, the research should go hand in hand. So that will be helpful for both the sciences. Now, who can do this research? So it is not like only academicians can do the research or only the practitioners can do. All people, all who are having interest or the degree or the graduation, post-graduation, masters or the PhD in Ayurveda can do the research in Ayurveda, and also we can present it. So along with that, now till now there was only two things were there, that it is a whether it is a academician or only practitioner. But now, as the time has changed, we are having different startups in India or in abroad also, and those startups who are having the in-house labs for R&D labs, they can do the research in their for their products. So as I am associated with Atre Innovations, we are having our DSIR approved lab, and through which we do all the research and development of our product, which are based for Nadi Pariksha and other things, through this government recognized institute. And we got different grants and all that I will discuss with you in the next slide. So as I'm emphasizing again and again is the need of evidence base. That's why research came. So research is not like there was nothing and we are trying to prove it. We know that Ayurveda science is having a good fundamental background. We also know that there is a great data collection in our text, through our text. But now we want to give this data in today's language. That's why we are going to use this word research. Okay. So what are the 5 main domains for Ayurveda research that I have mentioned here? The first one, which is the fundamental, that we all know about our Sharir Kriya and about our all the Ashtavida Pariksha, that will come in the fundamental. The literature part, which in which the papers are written in more number, because this is mentioned in our text and we could find it out through our practice or our observational studies. So that literature part is coming. The next one is the preclinical stages, that without any medical intervention, how you can show your results or the science behind that. The fourth one is the clinical studies like Nadi Pariksha or any gynec related issues you can present through your case studies, or like the hair loss, the lady who, the doctor who presented about that. So in that way, we can put the different clinical research papers and can prove these studies or our results. And the last one, and which is very important and which is having the maximum R&D in India, that is the pharmacological. Because all the medicines or the formulations which are given in the Ayurvedic text, those are getting I will say the preparations are going on in the pharmacies, and they need the good R&D for this pharmacological preparations and their evidence base and giving the best results for their products. Now, research is not only the paper writing, okay? So along with the paper submissions and the publications, the very next part comes is the proposal writing, which is for different grants. So if you want to do any research, as our topic is to find out the opportunities also in the research, so you should search mainly for some or there are different platforms which are given by the Ministry of Ayush, our government of India. So there you can find out different things or the subjects through which you can present your work. Also, the CCRS is our government body, which comes under the Ministry of Ayush. That is also helping us to show our results, prove our science, and to present our research. Okay, so CCRS is also there, through which you can do the research things. Then the All India Institute of Ayurveda, New Delhi, that is also promoting and helping for the different research projects. Niti Ayogs, as I mentioned about the startups, under Niti Ayog, different startups can present and get grants for their research things. And I'm very happy to share with you that for Atre Innovations, we got a good grant from Niti Ayog also, as we are DSIR approved too, and now Niti is also helping us. Now there are also different government institutes through which you can do your research studies, because we need money for the research, right? The funding is very important. That's why such institutes are helpful for us to get the funds. There are some deemed universities in India. Those are also helping from their internal funds to do such researches. So you can approach them, you can write proposals to them. Proposal writing is a different art. So you have to make more and more practice to how to write a proposal. And that proposal writing will help you to get good grants or the funding for your research. As I mentioned this thing only for the India, but abroad, the international level also, you can get grants from different institutes like EU Commission, Indo-Sweden grants, or USA grants, or Australia. There are different grants for this, our medicine also, that is Ayurveda and yoga. We can get all these things, for these things, the grants, which mainly comes under the public health also, or we can say as it is a alternative medicinal therapy, because abroad or the Western countries, we consider as an alternative therapies. So we can get grants, a good number of grants, good funds from there to do the studies, research studies in India and abroad also. So you are having a good open thing is there that we can get more and more funding from them. As I mentioned, that proposal writing is an art, and we have to make it very keenly. We have to do it, the word and word things, we have to write it very precautiously. So this proposal writing is a new thing maybe for many of the Ayurveda students or practitioners. But if you get a good guidance, you can do this proposal writing and get the funds. Now, as I mentioned, the funding is there, research is there, but publication is also important. But don't run after only for the any type of publication. So you should search for the national and international journals and conferences, which are the best one. There only you should publish your papers or your work. Check for the good impact factor of that journal. Then only select it, because there are many, n number of now platforms and journals are there, which are ready to publish the Ayurveda based or yoga based papers. But choose a good impact factor, and then only there will be a good weightage to your work. Also check for Ayurveda, yoga and interdisciplinary journals. That is a main point. Don't go only for the Ayurveda or yoga, but where the interdisciplinary, where the modern science, the Western science, and our ancient Ayurveda science can come together and we can present it. There you, such publications you select and submit your work. So this part was regarding the research, how we can do and what are the era or what are the openings for the research things. Of course, many questions will be there in your mind, but start thinking over that and we will discuss if time permits today, or else I am available on my phone or the email also. So now next part for my topic is the innovations. So from research, of course, research is the best. Research is needed to prove your innovation. Okay, so innovation is not only the tech part comes. Okay, But as Ayurveda is an ancient science, we have to make it, or we have to explain it into the today's language. What we needed is the technology. So innovations can come up with n numbers, but if you want to reach more and more people, you want to reach out not only in India but the Western countries also, then technology is important. As we all use WhatsApp so easily, and we can call and we can chat with our family and friends. So that is a technology which is helping us. So in the same way, this technology will help us to enhance our science and give our science a more and more creditability. So for the innovations, we need the technology, we need the big data. The terminology big data, maybe many of you know, but the big means not a big in number. Okay, a few lines is also important, but if they are having great weightage, that few lines will also be a big data. So in my domain of IT, healthcare, and technology, we now I'm introduced to this new world of tech around 7 to 8 years ago, and I'm working with this now words also along with Ayurveda's ancient science. Along with that, what we do in using the technology or to prepare a new product which is tech based, that is the machine learning or the artificial intelligence. So ML and AI, these are the main things which we use for the technology purpose. And of course, the intelligence is given by a man, and that intelligence when we give to give our machines and all, then only we can get the results from the that device or from that product. So always remember that it is not like you will be get everything from the technology. Okay, if you have that knowledge, if you provide that knowledge to that product or machine or that tech, then only you will get the results. So same what we did in the Nadi Pariksha. So we are having a good database of Nadi. We are having good inputs from Nadi Vaidya, and we taught all those things to our machine, and that machine now works with their own brain and gives us the results. So this is the world of ML and AI. Also, what the technology can do and help us, that okay, we are having our case papers, we can write the pathological reports on the case paper, but capturing of data and storing it, okay, we can store it in our brain, but it is not visible to others. We have to show the evidence. So capturing of that data, just storing that data, that is also very important, and which is possible only with the tech. And that captured data should get monitored, should get analyzed. We can show the difference between the different visits of the patient. We can give the monitoring of those health parameters. Like in Nadi Pariksha, we heard that there are different parameters, whether the Nadi is palpable under V, P, or K, or which finger, at which point, at which level. So those things should get captured, should get monitored, should get analyzed. And the very important thing comes is the tracking, that visit to visit, how the person is improving or no. So all these things are possible with the innovative products using technology. So here I am working as Ayurveda and data science together to come up with the different products or the things which will give you more and more, or will take you near to the good diagnosis. So what is the scope of the innovation? We should be futuristic and predictive as per our science. So very importantly, the first comes is the non-invasive diagnostic tools. So we are not going to cut anyone's body, or we are not going to take blood from their body as we do in different pathological tests. So non-invasive diagnostic tools should come. Ashtavidha Pariksha is our main fundamental through we do the diagnosis part. So Ashtavidha Pariksha, each parameter, we can combine that with the tech and come with a diagnostic tool. I will show you my work, how we are doing that one also. Then the third one, which is well known, which is a Prakriti analysis. So in Prakriti analysis, right now we are using only the questionnaire based Prakriti analysis. But when we combine that with tech, how it will give you more and more uh, uh, nearer to the correct Prakriti. That will also help us. Now there are different health platforms. That is also innovative product that we can come up with tech. Like there are different telemedicine platforms, online medical store available. So you can buy medicines from Amazon also. So such a things for our clinics, for our institutes we can make. Also there is the health platforms for the yoga is there. There are platforms you can create for the students as a connecting app, for the practitioners to connect as a connect app, so you can discuss more and more cases within and you can come up with a good results. You can do consultations through these platforms for your overseas patients, of course Indian patients and overseas patients also. Because of pandemic we got this opportunity that we can connect with anyone sitting at our clinic and can treat them. Also the very important thing comes is the virtual education services. So right now as we are doing this virtual seminar, in the same way we can do this for the education purpose. So it is no need that each and every person should come to our clinic or our institute, but with the virtual things, with such a platforms, as I am also having my own academy, Prakriti Ayurveda Academy, with which I teach for the overseas students the Ayurveda and all things. Also from India. Now the different sciences are also interested in Ayurveda. So many allopath doctors or the nutrition science students, they come to me to learn Ayurveda. So I'm using this tech in my daily life, and we can take privilege of that. So this is the scope of innovation where you can work, you can think, you can innovate, you can find or create a new product for you and your society. Now let's come to the 8 folds of examination, that is Ashtavida Pariksha. And in this Ashtavida Pariksha, everyone maybe know about that we are having our own Nadi Pariksha device, which is known as Nadi Taringiri. I will come to that later. But what work we did next to that is the tongue analysis app. So I will come to that point. So as we know, the tongue is the mirror of our metabolism, is mirror of our all stomach and the digestive health. So through tongue analysis, by giving this all intelligence to our app, our tongue analysis, the tech does the tongue analysis and it gives you a score, which gives you the scores related with the armor present in your body. How is your digestive fire? How is the stress on your mind and body? So such parameters are coming through our tongue analysis. So this is a new product, or actually this product we launched 3-4 years ago. And through this selfie, you have to take selfie of your tongue and the analysis will come. So in that one, we gave the scores, we analyzed it, we monitored it, and we give the trends also, that how your tongue health or your gut health is improving or no. So one of the things from Ashtavida Pariksha, along with Nadi, we worked over the tongue analysis also, and we are having this tech app for tongue analysis. Now next I will come to the Prakriti analysis. So as I mentioned that Prakriti, what we do right now is the questionnaire based. But along with that, to move towards more and more clarity, we are having a new tech introduced by us, and our studies are going on for the Akruti Pariksha. Okay, we know that how Ayurveda has described about the Swanguli Pariman, then how the praman is given, the length, breadth, circumference, all the organ system. So we try to measure all those things through our AI, and we will give you the Prakriti which is nearer to whatever is coming, but as along with the questionnaire based whatever the Prakriti analysis is there. So we are having this Akruti analysis which we are doing right now. So for that, we do analysis of hands, legs, face, and the full body structure, how it is having the Praman, and how balanced state it is or no. So let me move to next slide. That is the along with the Akruti, we are working for the face analysis. Okay, we know our text is also given a different shapes of the face. That Kapha Prakriti is having the round face. The Pitta Prakriti will have a medium sized face, or the Vata Prakriti will have elongated face. And the sizes along with that, what are the sizes of the eyes, nose, lips? So we are working on that part also. And we are having our face analysis, or the face tracking thing also is going on with this take part. And we will come up with this things in our Prakriti analysis product. So these are also a new things, and many students or the doctors can come up with new ideas and studies for this work at Atreya. Now this is the main product we had. We launched it in 2008, and Nadi Taringiri is the product which do the Nadi Pariksha, and it captures the data. It with the artificial intelligence, it gets analyzed, and you will get a report card which is in a Ayurved language, which of course the language we have transferred from the whatever the sensors has captured from the graphs and numbers to Vikruti, Gati, and based on that, we will give you the diagnosis and the lifestyle corrections also, which includes the Ahar and Vihar. So this is our product which we developed with a great research and development through Atreya Innovations, which is a Nadi Taringiri. And very happy that more than 600 Vaidya all over India and few from abroad also, they are using Nadi Taringiri to help them in the diagnosis. Now, these are some wordings I want to share, that how Nadi Taringiri, the data which we have captured, now we translated into the Tridosha language, and what the parameters we used in there. So like we use the time domain, because the Nadi is moving, it is running. So depth, intensity, amplitude, and force is captured. Frequency domain is captured, which is the speed, frequency, and rhythm of the Nadi. Akruti, how the Nadi looks, that is length, its type, shape, quantity, and texture. The 3D diagram is also, we can see through this Nadi pattern, which gives the width and volume of the Nadi, and field, which is the temperature. And all these languages we have transformed into the Ayurveda language, which are with based on the Gati, that is Sarpa, Manduk, Hamsa, then Guna, Agni, Bala. All the parameters are given by the Nadi Taringiri, and we give the we suggest you the in which way the Nadi is going and what are the probable diagnosis of this patient. Now, as I talk about three things from the Ashtavida Pariksha, that is the Prakriti Parikshan, Jivha Parikshan, and the Nadi Pariksha. Of course, there are the remaining part that are also open for us to work and to find out more and more innovative products using the technology, how we can do it, because there is a good explanations are given in the ancient text about the Mutra Pariksha also, how the Mutra color, the volume, the viscosity changes in different disease pattern. That also product can be prepared through using these tech things. Mala Pariksha is also there. Swara Pariksha, we are working on the audios also. Swara Pariksha, that we are also working with. So all these things from Ashtavida Pariksha, as I am as a domain expertise for Ayurveda and working with a tech industry, I'm trying to give all these inputs and coming up with a new good R&D and the products. Now the next product what I worked for, that is the Ayurveda and the nutrition science. So as we are giving Ahar and Vihar everything to the patient, we suggest, we ask them to follow it, but again, just not to suggesting it, but to how they are following it or no, that tracking is also very important. And that's why we came up with a diet and nutrition app also, which name was Turiya, and through which we gave the Nadi analysis, the inner health parameters, and based on that, we gave the personalized Ayurveda based diet plans. The diet plans are like early morning, the breakfast, the lunch, the evening snacks, the dinner time, all the recipes, all the suggestions as given as per the Nadi Vikruti, their disease patterns, and the Guna or the whatever the Ahar Shastra is there in Ayurveda. Based on that, we gave all the diet plans, and along with that, we shared the recipes also. So Ayurveda with nutrition science, along with the tech, we can make such apps also. What app we are having here, we are having Nadi Pariksha and the app also. So in that way, you can come up with different things, and you can create your own tech part or the own tech apps also for your patients, for your clinics. So here, through my app, what I did, that is the lifestyle corrections, which is with Ahar, Yoga, Nidra, and water. That is the Jalapan, hame kitna karna hai. So that water intake, that is also there through these personalized Ayurveda-based diet plans. And very importantly, as I mentioned, tracking of that diet and habit formation, which is very important. It is not like only Deepan Pachan, the person should follow the diet. No, but after that also, when we are treating it with our Chikitsa or Panchakarma, they should follow our diet. That tracking is possible with such a tech apps. So I think I have covered many of the points, and as the time is also, we are having a good time limit. So I will like to stop here to, as I shared about the what is the research, what are the areas of research you can do about the things. You can come up with the innovative products using the technology that will help you to come up with good and new things or the dimensions to the Ayurveda. And I thank Dr. Shilpa ma'am for inviting me here and giving me this opportunity to present my research and innovation work in front of you all. So thank you very much. And once again, I wish all of you a happy Women's Day. Thank you.
Thank
if
you,
any
ma'am.
questions are there,
Yeah.
they are welcome. Or you can mail me. My website it was there, prakrutiayurved.com, or my mobile number is there. If time is not there, we can discuss.
Yes. Thank you, ma'am. Very apt presentation. I think this year's theme, visit all, and you have educated in all the means, and it's really great pleasure and interesting part. And you are, as a lady, you are doing very nicely, and really proud feeling. I think all the women are doing in their field. I really thank all the speakers, Dr. starting from Panchakarma, Dr. Shubhangi Apashim, Dr. Suvarnlata ji, Dr. Anura Baleji, Dr. Tejaswini, Dr. Sudha ji, and Dr. Nirmala ji. Thank you very much. I am just sharing a small certificate. I think a certificate is not much more important, but still I am sharing as a part of, as just a token of gratitude from our side. And I will share it on the WhatsApp too. Sudhaji, I'm just showing. Thank you, Dr. Abale ma'am, for your administrative experiences.
Thank you, madam.
Dr. Nirmala ji, for your, I think, trichology interesting part, and all are doing very much. Dr. Shubhangi for her Panchakarma practice, typically in the Basti. And Dr. Suvarnlata ji for skin diseases and Ayurveda. So this is just from ourselves. And thank you very much, all the ladies. And it's really nice to meet you. Thank you. Thank you once again, and happy Women's Day. And I'm ending the session with token of gratitude, and all the participants also. Thank you very much. This is the live on Ayush Darpan Facebook page also. So thank you very much, ma'am. Thank you. Bye.
Bye.